Hello again, my name is Dr. Podbielski. I'm the Director of Spectrum Physical Therapy in Niantic. I wanted to do another short video today just talking about the joint-by-joint approach and how we use this theory and this approach at Spectrum. So basically what the joint-by-joint approach means is that each joint in your body has different needs on a day-to-day basis. So those needs could be either mobility-based, meaning those joints need to be able to move around a lot, or stability-based. So you want those joints to be nice and stable while you're walking, while you're running, while you're going up and down stairs, what have you. So generally the way it lays out in the body is it kind of goes back and forth with each joint. Your ankle is meant to be a mobile joint, knee's meant to be stable, the hip's meant to be very mobile, your low back, your lumbar spine is meant to be stable, thoracic spine is meant to be mobile. And then going up, down to the extremities, your shoulder's meant to be mobile, your elbow's meant to be stable, wrist's meant to be mobile, and what have you. And this pretty much repeats itself throughout the whole body. If you're looking at the spine as a unit, it's meant to be areas of stability and areas of mobility while you're functioning. Often when you come in for an eval for physical therapy at Spectrum, what we're doing is we're looking at your whole body. We often get questions from, we might have a pitcher come in and they'll ask them why we're looking at their hips because, with especially a motion like pitching, you're going to require a lot of mobility at certain joints and a lot of stability at certain joints. And the hip happens to be one where folks are often very tight and they require a lot of mobility for pitching. Again, looking at the needs of different joints is important for what your goals are. A common one we see here is disorders of the feet, whether it be plantar fasciitis or Achilles tendonitis. And a lot of times it's because they are lacking mobility in the ankle, which should be a mobile joint. And if those calf muscles or that joint capsule is very tight, the ankle is going to lose mobility and it's going to tend to build up a lot of stress at either the Achilles tendon or plantar fascia or what have you. Oftentimes those folks' goals are just to return to walking pain-free, things like that. So we'll be working a lot of mobility exercises and manual techniques. And you can look at that for every joint. The hip's a common one where folks get very tight, maybe from sitting all day. Commonly folks who have to have a desk job who need to sit, they get very tight in the hamstrings, very tight in the hip flexors. And your hip needs to be mobile for most functional activities, whether it be sitting down, squatting down, going up and down stairs, or especially in athletics. Someone who's a pitcher needs a lot of mobility. Someone who's a golfer needs a lot of mobility. So what we try to do at Spectrum again is pick apart different things throughout the whole body that we can help to improve symptoms, but ultimately help prevent any further symptoms from coming on. So that's basically the joint-by-joint approach. If you guys have any questions, go ahead and comment below. Please like and share our page on Facebook and Instagram and on YouTube. Thank you.